Thank you, Chairpersons, and my thanks to the organizing committee members for inviting me and also giving me this opportunity to talk on gender in a conference of delegates. Thank you very much. So, we actually are looking after the gender diverse people for the last 15 years. So I will go through this agenda. But the first thing, let me talk about a little bit of sex and gender, which we often actually interpret or we use interchangeably. But there is a difference between the sex and gender. Sex is something which basically phenotypical and which is assigned at the time of birth. And in almost all cases, we don't have any control about the sex. But gender is something which we feel about oneself, and that is basically resides in our brains. So in more than 99% of the cases, the gender and sex are basically aligned. So we are not wrong when you are using gender and sex interchangeably, but you are not absolutely right in 100% of cases, because some of the people there may be some sex and gender may be different. And I am going to talk about those people whose sex and gender are not actually aligned. So let me give you one example. And we are talking about the gender non-binary. It means that the whole human population in this world cannot be divided into male and female. Yes, more than 99% you can divide, but less than 1% people will not fall under the category of male or female, and we call them as genderqueer. And now this is basically considered under the heading of gender non-binary group. So this is an example. This person came in our outpatient department, and just looking into the person, we feel that what the person is expressing is not exactly what the person has as far as gender or sex is concerned. So we asked him to undress, and you can see that this is basically completely man. So this is basically the biological sex which I am talking about, and this is the gender expression with this biological sex, how the person is presenting himself. So if we look into a different angle, so we are born with the biological sex, but even with this biological sex, our expression will be different. And deep inside our mind, we have another issue, that is our identity or psychological sex. So apart from these three dimensions, there is a fourth dimension, that is the gender orientation, that is the sexual or romantic attraction. So attraction, or it may be sexual, it may be romantic, maybe towards the same sex, maybe towards the opposite sex, maybe towards the both sex, maybe towards none. So any permutation combination is possible. So basically we have four dimensions of sex. One is biological sex, second is gender identity that resides in our brain, third is gender expression, how we want to express ourselves in the community, and fourth is orientation. That means what is our attraction, it may be sexual, it may be romantic. So when somebody on the extreme on the left side, then we call them cisgender heterosexual man. On the right side, we have cisgender heterosexual woman, and in between, I think we have many shades, and that's why we have 50 shades of gender. So I have discussed a little bit about my experience, and you can see that most of my experience are basically based on with our transgender community. And transgender means a person who is assigned male at birth, but his identity or gender identity is basically female. Then we call them transgender women. On the other hand, someone who is assigned female at birth, but the gender identity is basically male, and we call them as transgender man. So they actually comprise the largest group as far as the gender community or gender group is concerned. So it was initially termed as gender identity disorder, but this terminology has been changed, and it was said that gender dysphoria means the people has got some dysphoria because of the mismatch between the biological sex and the gender identity. But I can tell you that all the persons who have the gender identity disorder don't have gender dysphoria always. But very recently, the terminology has been changed to gender incongruence, and it is not considered under the heading of any disorder or mental health or behavioral issues. So this is another example. This in 2001, this young boy came to me with puberty gynecomastia, and he was not very much apprehensive about the gynecomastia. gynecomastia. Just like many other cases, he was lost in follow-up and came back to me in 2010 with the persistence of the gynecomastia. When I discussed with him his issues and his anxieties and the worries, and I found that possibly he is suffering from gender identity disorder. He had a suicidal thought at that point of time. Then we made the diagnosis of gender identity disorder. He received the hormonal therapy, and then he underwent through the reassessment surgery in 2013. After this reassessment surgery and hormonal therapy, you can see she is sitting there with a smiling face. Now we have published our 55 transgender subjects around a few years back with the Mother Journal as well. Now, in the reverse side of the story, this is a 20-year-old biological female started the testosterone therapy. Breast surgery was done 12 months after androgen initiation, and then after in the follow-up with the androgen therapy, this is basically transmasculine. And we have actually published our few cases from our cohort as far as this our experience with the female transgender subject is concerned. So currently we have roughly around 400 patients in our hospital OPT in Texas Medical College. Giving you some varied example, this is a 20 years old female student of comparative literature, assigned sex female at birth, sexual orientation female, but mentally and physically attracted to female, and her mother was worried, not interested to change her gender, but she had a lot of anxiety and thought herself insecure and alone. This is a 20-year-old boy, a student of commerce, assigned sex male at birth, sexual orientation female, mentally attracted to male, disliked interacting with women, and he had anxiety and huge challenge for his parents. This is a 20-year-old male. He had a tendency to talk excessively woman-like behavior, woman-like working. He was bullied by the peers since adolescence because of his female mannerism, not interested to change his gender. But very importantly, he had attempted suicide twice because of these issues and anxiety and depression. This is a 26-year-old young lady was diagnosed as congenital adrenal hyperplasia. But after spontaneous puberty at the age of 12 years, now she deserves to be male and adopt a male to become behavior. So that actually raises a very important question that how we should rear our patient with congenital adrenal hyperplasia. What should be the assignment? How we should assign the sex at the time of birth, and it raises a very important question whether is male sex rearing is a good idea for people with congenital adrenal hyperplasia. Now, this is very interesting. On the left side of the panel is someone who actually was girl and he wants to become a man and was undergoing through the hormonal therapy. And on the left side is someone who is basically a man and wants to become female. So they are coming in our clinic and they got romantically attracted to each other. Now this is another couple. So on the left side, on the right side of you is someone who wants to become female. So he was receiving the hormonal therapy, and on your left side is basically a female, or the biological sex is female. She is complete female, but she had a relationship with this one. So I asked her why you are having a relationship with someone who wants to become female. So she said, I am basically bisexual. So this is another 23-year-old young man, and he had dysphoria from the facial hair, and he used a razor 2 to 3 times daily to remove all the hairs from his face, and no attraction towards the men and women, not interested to develop breast or change his gender, but he had a lot of dysphoria because of the facial hair. This is a 32-year-old from Bangladesh, consulted our clinic for female hormone therapy, underwent castration at 14 years ago by a quack in the Israel community. And this was the operation, and you can see this was basically a very, very mutilating surgery. We have actually presented 3 cases of castration in the Israel community in our documentation. So when we ask this question, how many types of gender we have? Now we are basically very much confused, and now you are confused. So one end of the spectrum is a man, and another end of the spectrum is a woman. In between we have the trans community, trans-masculine, trans community. But there are many other people whom we cannot classify, and they actually belongs to one group that is genderqueer, and they consist of roughly around 0.6%, and 0.6% in our country, roughly around 50 lakh people. So 50 lakh people are basically under the heading of genderqueer. So, looking into the concept of the third gender, the concept of the third gender is not new. It was there in our mythology, in our scripture, in our sculpture. So, not only in this part of the world, but if you look into that part of the world, this is basically a Greek marble statue from the 7th century BC, and you can see that the breast and penis in the same statue. So the concept of the third gender or something beyond male and female, this binary concept is already there for a very long period of time. So this group of people consist of third gender, or we sometimes call them a genderqueer, or you can say a rainbow community. Anybody who is not heterosexual or cisgender should be considered under the heading of this third gender community. So Israel is officially recognized third gender community in India. We have intersex disorder, transvestite. We have LGBT community, which I think all of you are quite familiar with. And we have two spirited, asexual, ally, bigender. Bigender means person who moves between feminine and masculine gender, and identities and behavior depending on the context in the same life. And if we cannot place them in any of these headings, we keep them under the heading of queer or the question. So, looking into this diagram, you can understand that we do have a pointer. So, the biological sex is basically the starting point. We have the gender identity, which is inside our brain. We have attraction or orientation, romantic or physical towards somebody else. And with all this, we have an expression, and we call it as gender expression. So basically, on one hand we have straight male, and the other hand we have straight female, but in between we have lot of flavor or lot of shades. So that's why it is 50 shades. Now, why we are talking about this? Why, as a physician, why we should know about it? It is basically of the fact that they have lot of health risk. One of the important health risks is the mental health, post-traumatic stress disorder, anxiety, depression, personal disorder. But also they have lot of substance abuse among these group of people. And so we have looked into our data to see what is the prevalence of this substance abuse in our people, and we have found only in our country, or at least in our cohort, we have found smoking and alcohol only as far as their substance abuse in those cohort. Now, another important issue of the health is suicide. So suicide is quite common in the trans community. Roughly around 25% or 1/4 of the people actually had some suicidal attempt at least sometime in their life, and mostly the suicide occurs in the transgender adolescent people. So they commit suicide at a very, very young age. So there is hardly any data of the suicide in our country. So we have only this publication available, published in 2016, and it suggests that the attempted suicide before the 20th birthday is 15% of the total trans community. We have looked into our data as well, and we found that 25% of our cohort actually had suicidal thought and attempt. But let me tell you that we have looked into those who have attempted suicide but failed and then come to our clinic for the therapy. But we don't have any data those who have successfully committed the suicide, and that data is not available. So the take-home message is that the non-binary genderqueer identity should be recognized by the healthcare service system. The treatment is available to assist people with gender dysphoria and to find the gender role that is comfortable to them. And we need to create a welcoming clinical environment, not only for transgender individuals, but also for non-binary genderqueer people to disseminate right information and reduce health risk. I will conclude by saying one line from Tagore, that is Aro Alo, a non-product Alu. So this is a short video for all of you to enjoy.
कितनी बेचैन हो के तुमसे मिली,
जो मैं हूँ वो उन चीजों के अंदर छुपी हुई थी, और उसके अंदर एक मेरी मम्मा की लिपस्टिक थी,
गुड़िया थी, ज्वेलरीज। कितनी बेचैन हो के।
As a kid, I did not understand what a trans person is. I always felt I'm a woman, but I was not allowed to share it with anyone.
लड़के का लड़की बनना, तो इसीलिए मुझे मतलब मार पड़ती थी, इसीलिए मुझे छुपाना पड़ता था ये सब। पहले मैं घर को क्यूट कर चुकी हूँ। तुमसे मिले।
फैमिली की याद सबको आती है कि मैं जिंदा भी हूँ या मर गया। खून तो उन्हीं का हूँ।
तुमको क्या थी खबर, थी मैं कितनी अकेली। ये चूड़ियां मैं बचपन में पहनती थी। ये सब मतलब देखकर ना मैं थोड़ी इमोशनल हो रही हूँ।
So I'm gonna open this.
It says Santosh Kumar.
This is Lakshman's box. A razor, a nail polish, a lovely bracelet.
And we also have a little note.
I like to look in the mirror when no one else is looking. Let's look at children in the way that they look at themselves. Let no child have to hide from the world.
तुमसे मिली
जो मैं हूँ वो उन चीजों के अंदर छुपी हुई थी और उसके अंदर एक मेरी मम्मा की लिपस्टिक थी, गुड़िया की ज्वेलरीज, कितनी बेचैन होके।
As a kid, I did not understand what this trans person is. I always felt I'm alone. But I was not allowed to share it with anyone.
लड़के का लड़की बनना, तो इसीलिए मुझे मतलब मार पड़ती थी, इसीलिए मुझे छुपाना पड़ता था ये सब। पहले मैं घर में क्यूट करती थी। तुमसे मिली
मैम देखिए यार, सबको आती है कि मैं जिंदा भी हूँ या मर गया, कौन तो नहीं गया।
तुमको क्या थी खबर मैं कितनी अकेली ये चूड़ियां तो बचपन में पहनती थी, ये सब मतलब देखकर मैं थोड़ी इमोशनल हो रही।
It says Santosh Kumar.
This is Lakshman's box.
A razor, a nail polish.
I lovely bracelet.
And we also have a little note.
I like to look in the mirror when no one else is looking.
Let's look at children in the way that they look at themselves. Let no child have to hide from the world.